Learning medicine is hard work. Osmosis makes it easy. It takes your lectures and notes to create a personalized study plan with exclusive videos, practice questions, and flashcards, and so much more. Try it free today.
Human herpesvirus 6, or HHV6, is a double-stranded DNA virus which belongs to the Herpesviridae family, subfamily Betaherpesvirinae, genus Roseolovirus. HHV6 primary infection is the cause of the common childhood disease called Roseola infantum, also known as exanthema sibidum, or sixth disease. Human herpesvirus 6 is a double-stranded linear DNA virus surrounded by an icosahedral capsid, which is a spherical protein shell made up of 20 equilateral triangular faces. The capsid is covered by a protein layer called tegument, and enclosed in an envelope, which is a lipid membrane that contains viral glycoproteins and is acquired from the nuclear membrane of host cells. Now, HHV6 infection begins when a person comes in contact with respiratory secretions from another person who contains the virus. Once in the body, the virus attaches to dendritic cells, which are antigen-presenting cells that can be found in the skin, nose, lungs, stomach, and intestines. These cells are able to process antigens like viral proteins and present them on the cell surface to the T cells. So when the virus attaches to dendritic cells, it activates them, and they migrate to the lymph nodes, where they interact with CD4 positive T lymphocytes. When dendritic cells and T cells interact, the virus gets ingested by T cells, and they get infected. Inside T cells, the virus can replicate most efficiently. So it undergoes the lytic cycle, where its DNA gets transcribed and translated by cellular enzymes to form viral proteins, which are packaged into new viruses that leave the cell destroyed and subsequently infect neighboring cells. The virus can also replicate into a wide variety of other cells, such as monocytes, macrophages, natural killer cells, astrocytes, megakaryocytes, and glial cells, but not as efficiently as inside T cells. Finally, HHV6 can go into a latent state in monocytes, where the virus just hangs out inside the cell instead of killing it. This may sound harmless, but in people with immunosuppression, especially after a bone marrow or organ transplant, the virus can reactivate and cause serious infections, such as encephalitis. Most often, though, HHV6 causes a disease called Roseola infantum, which usually occurs in young children aged between 6 months and 2 years. The disease has an incubation period of 1 to 2 weeks. After the incubation period, the disease debuts with a high fever that may exceed 40 degrees Celsius or 104 degrees Fahrenheit, and usually lasts 3 to 5 days. During the febrile phase, other manifestations include periorbital edema, acute otitis media, rhinorrhea, or a runny nose, cough, vomiting, diarrhea, a bulging fontanelle, cervical, occipital, or post-auricular lymphadenopathy, and Nagayama spots, which are small red spots on the soft palate and uvula. After the fever goes away, a maculopapular rash appears, which is when pink or red spots develop. They appear on the neck and trunk first, and then spread to the face and extremities. The rash usually lasts 1 to 2 days, but sometimes it may go away within as little as 2 to 4 hours. Roseola is usually diagnosed based on clinical findings. The presence of HHV6 can be demonstrated by cultivating the virus, using PCR to identify viral DNA from clinical samples such as blood, cerebrospinal fluid, or respiratory secretions, and also by demonstrating a rise in IgG antibodies against HHV6. Treatment is usually supportive since Roseola is a self-limiting disease. Fever can be controlled with antipyretics such as acetaminophen or ibuprofen, and in case of vomiting or diarrhea, fluid intake should be increased to prevent dehydration. The rash goes away without treatment. In severe cases, like HHV6 infection in individuals with immunosuppression, antivirals like acyclovir or ganciclovir can be given. Alright, as a quick recap, human herpesvirus 6 is a double-stranded DNA virus that replicates most efficiently in CD4 positive T lymphocytes. In young children, it causes a disease called Roseola infantum, which is characterized by high fever that lasts 3 to 5 days, and a rash that develops after the fever disappears. Diagnosis is usually based upon clinical presentation, and treatment is usually supportive. But in severe cases, antivirals like acyclovir or ganciclovir can be given.
Thanks for watching. If you're interested in a deeper dive on this topic, Take a look at osmosis.org, where we have flashcards, questions, and other awesome tools to help you learn medicine.